Did you ever dream of what you wanted to be when you were growing up? Let me tell you a secret. I wanted to be Superman, having extraordinary abilities designed to defeat the enemies of ordinary people. I was so disappointed when I realised he was a fictional character. I think I was 14 at the time. I realised my chances of becoming Superman were as slim as a cupcake solving algebra. Or were they? Perhaps that's why I became a general practitioner. Just like Superman, people come to us desperate for help with all kinds of fears and problems, and some of them are even in a medical book. But Superman has his nemesis, Lex Luthor. He is everything Superman is not. Superman's abilities and widespread admiration fuel Lex's feelings of inadequacy and jealousy. His weapon to enslave Superman is kryptonite. Do we have our own Lex Luthor? And if so, what is their kryptonite used to enslave us? Kryptonite is anything that places an extra burden on you and patients that doesn't improve their care or indeed worsens it and distracts you from the job of rescuing patients. Lex Luthors are those who impose those rules. I started to make a list of examples from my 30 years of working at the coalface in general practice, but I had to stop. It was just too depressing. I wonder if that's why so many doctors stumble over the line into retirement. It's just not fun anymore. Does it feel like that to you? What, already? Do you go home after a long day at work and say, guess what I did today? I up-titrated the statin dosage of a fit and otherwise well octogenarian, and I reduced their risk of a cardiovascular event by 2%. Woohoo! Or do you go home and say, I reassured 5 worried people today that they didn't have skin cancer, and they were so happy. You should have seen the smile on their face of relief. Or, I removed a patient's skin cancer today, saving them a trip to hospital, a few months extra wait and worry, and that's another referral to hospital my secondary care colleagues don't have to worry about. Dermoscopy is a door to a world of new possibilities in service to your patients. Let me show you what you can do in primary care, one of your potential new super abilities. How would you have managed this patient? A 75-year-old gentleman comes asking for your help. Over a few years, this has been growing behind his left ear and is now causing pain and problems when wearing his glasses. What do you do? It's soft to touch and you feel somewhat reassured by its long history. But what is it? Your dermoscope reveals hairpin vessels throughout within a milky white background. There's a bit of brown, but is this keratin or from trauma, you wonder? He doesn't want a long wait for a referral to hospital and asks, what can you do, doc? Changing into my cape, quick as a flash, I consider my options. Cryotherapy, sure, but it would be sore and inflamed for 2 to 3 weeks and there'd be no histology. Excision biopsy perhaps, but there'll be a sutures and that isn't really necessary. Then you turn to another superpower in your armoury, curettage and cautery. Your patient consents and we join the action after an injection to numb the skin. I'm using a blade to slice the lesion off the skin as close to the dermo-epidermal junction as possible. Where's my X-ray vision when I need it? The addition of adrenaline to the anaesthetic greatly reduces the amount of bleeding and makes the procedure less wasteful on gauze swabs. Do not rush this part, for as I was taught in woodwork at school, measure twice, cut once. All the while, be chatting to your patient, checking they are happy and pain-free. If not, throw in some more anaesthetic. And if you didn't leave any in the syringe, just talk about the weather. Compliment the patient on how nice it is to have a patient who isn't a bleeder for a change. No, I mean pause and give them some more anaesthetic. You've removed the offending appendage and you high-fived the nurse helping you. What now? Always send the specimen off for histology. Fail to do so is more chilling than being caught out in a snowstorm in only your socks. But your job is not yet done, it's time to repair the damage. Until 5 years ago, we used to use a medieval electric hot poker to cauterize this hole. In the 21st century, I recommend a hyfricator. Using electric cautery, this causes less tissue damage and has fully controlled power settings. It looks cool and adds to the I'm a proper doctor appearance. But warn your patients, as I do, that if you smell any burning, don't worry, it's not me, it's you. If you don't have good rapport with your patient, at this stage, forget that last instruction. If you really want to push your luck, say to your assistant, have you got that bun, salad and tomato sauce ready? Again, don't rush. Pause from time to time to locate the little bleeders. You don't want your patient coming back later, dribbling blood from behind the ear. Not a good look for them or you. Watch what I do to this little flap of skin flapping in the breeze, touching it until it shrivels up. This is the same technique you can use to treat small skin tags if you're happy you don't need histology. When you're happy your patient isn't going to bleed to death, clean the area with sterile water and apply a dressing of your choice. Make sure you give the patient written wound management instructions, what to do if it starts bleeding, and how to contact you urgently. I tell them I will contact them in 4 weeks' time for a patient satisfaction report and the histology report discussion. Did you think that was a seborrheic keratosis? Well, if not, you learned something. What was your plan of how you were to manage him? Was it to reassure him it's not cancer and tell him to put up with it? Did you feel it was something that needed treating, but you didn't have the skills at the moment to do that? Would you therefore have referred him to someone else in secondary care? Curettage and cautery in the UK NHS system is considered a core service, and therefore there is no fee for service I can claim. All I earned for my practice is the reimbursement cost for the materials I used. The Lex Luthors of this world don't value what I just did for the health service. They can't see it because the referral I prevented isn't counted. And if it can't be measured, it doesn't have value. But I tell you what, it counted to my patient. He was so grateful. And I go home after a hard day's work and say, I did some good in this world today. Do you know what the secret to surviving a long career in general practice? It's this. And to Lex Luthor, I say, training a primary care dermoscopist for every general practice.